Damage to anemia and methods of treatment. Learn with us in this video about the harms of anemia on the human body and ways to prevent it. Anemia is one of the common diseases in the world, and delay in treating anemia may cause a number of damages and complications to the patient's body. Learn more about the harms of anemia in this video. Anemia damage. Red blood cells carry oxygen and are an important factor in delivering it to the various tissues of the body, so a low hemoglobin level or red blood cell count may cause a range of damages to the patient, especially if the anemia is severe. Anemia may cause a group of complications, and the damages of anemia include the following. 1. Cardiac complications. Anemia may cause an increase in the heart's work effort, as the heart compensates for the lack of blood's ability to carry oxygen by increasing the power of blood pumping and increasing the number of heartbeats, which leads to stress on the heart muscle, which in turn may lead to a group of complications, such as myocardial hypertrophy and heart failure. 2. Complications on pregnancy. Maintaining the blood level and its ability to provide the fetus with oxygen is important during pregnancy, so if the anemia is severe during pregnancy, it may lead to premature birth or the birth of the baby with a low weight. In addition, anemia during pregnancy may cause a baby to become anemic during the first years of life. Anemia during pregnancy may also increase the risk of bleeding during childbirth and postpartum depression. 3. Depression. Depression and mood disorders are one of the effects of anemia. Depression may occur for various reasons, including anemia is a risk factor for depression. There are some diseases that cause anemia that may cause nerve damage, such as pernicious anemia, which causes a deficiency in vitamin B12 levels. 4. Weakened immune system. Anemia is one of the reasons that may weaken the immune system, which increases the risk of infectious diseases. 5. Restless leg syndrome. Restless leg syndrome is one of the complications of iron deficiency anemia in particular, as this condition is characterized by the patient feeling a desire that does not move the leg. 6. Poor brain development. Iron is an essential component of brain development, so iron deficiency anemia in infancy and childhood can lead to a delay in brain development. Diagnosis of anemia. To diagnose anemia and determine the causative disease, the doctor may need a set of the following tests. Complete blood count examination. Vitamin B9 and B12 level check. Checking the level of iron in the blood. There are a set of tests that the doctor may request if he has suspicions of a specific disease, and these tests include the following. Examination of blood and urine in cases of hemolytic anemia. Colonoscopy or fecal occult blood tests in case of gastrointestinal bleeding. Bone marrow biopsy in some cases, such as aplastic anemia. Ways to treat anemia to avoid its damage. Treatment of anemia depends on the disease causing the anemia, and anemia can be treated as follows. Iron deficiency anemia. These conditions are treated by giving iron either orally or intravenously and changing the diet. Vitamin deficiency anemia. The patient is compensated with vitamins and his diet is improved. The patient may need vitamin B12 injections if he suffers from difficulty in absorption. Aplastic anemia. The patient may be given blood units to increase the levels of red blood cells, but he may need a bone marrow transplant. Sickle cell anemia. The patient is given oxygen and pain relievers, he may need blood transfusions and folic acid. The patient is treated with hydroxyurea. Thalassemia. The patient may need blood transfusions and folic acid supplements. He may also undergo splenectomy or bone marrow stem cell transplantation. Thanks for watching.